Is healthcare coverage a government responsibility?
Healthcare boils over. America's rise in health insurance premiums has outpaced inflation.
The president does not want to harm qualified beneficiaries of Medicaid. This bill will.
Should the ability to live a healthy life be something you earn or something you're guaranteed?
Hello, my name is Sasha and
And my name is Sharvanya. In this video, we're going to be looking at one question. Does America truly protect its citizens' right to life?
First, we will look at the right to life and what it really means when it comes to healthcare. Then we will examine the US health system and compare it to the ones of other nations. And lastly, we will examine the big beautiful bill and its cuts and how they affect ordinary people.
Healthcare is not just about money and medicine. It is about people and their natural rights. The Declaration of Independence states, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness."
Americans deserve a lifeline. They deserve to have the tools to build their own success. They don't deserve to be pushed down and left behind.
In this video, we will focus on the first right, the right to life, because the right to healthcare is the right to live.
Hospitals, healthcare professionals are all there to protect that right, help us heal and get better. But when people avoid hospitals or medications because of cost, that right, the right to life, is put at great risk.
High deductible health plans, lots of cost sharing, and that tends to lead folks to delay care. Do things like take lower doses of prescribed drugs, which is not good, or avoid going to the doctor when they need it till it's a later stage in disease and harder to treat. So it has real consequences for the health of Americans.
The right to life is written into America's foundation, but when healthcare is expensive and access is limited, that promise starts to fall apart. So how do other developed countries protect that same right, and why do their outcomes look so different?
The United States spends more of its gross domestic product on healthcare than any other developed nation.
It goes faster than inflation. It goes faster than our wages go up. It takes a larger and larger share of our income. On average, almost $1 out of every $5 earned in the U.S. goes for healthcare.
Yet higher spending doesn't necessarily mean better outcomes. Despite spending more money per person on healthcare than any other developed nation, the United States still has a lower life expectancy than many of them. In countries that spend less, people often live longer.
Unlike many developed nations that operate under a single universal health system, the U.S. relies heavily on private insurance.
What really makes the U.S. stand out compared to other countries is just the large proportion of our population that gets their coverage through private insurance companies.
This makes the United States system extremely fragmented, where access to care is directly linked to employment, income, and insurance status.
In many developed countries, preventive care is widely accessible. In the U.S., preventive care is often delayed or avoided due to many different factors, but mainly because of a lack of doctors who can offer that care. If the right to life is a core value of American society, why is the access to healthcare less available here than in other developed nations? These differences don't happen by accident. They are shaped by policy and funding decisions made by the federal government. One of the most significant recent decisions is a federal spending bill, commonly referred to as the Big Beautiful Bill, which includes major changes and cuts to healthcare funding.
What Mr. Cannon's talking about is providing coverage that doesn't have key consumer protections, key benefits, no out-of-pocket limits, and people can be denied for pre-existing conditions or discriminated against for those conditions.
The One Big Beautiful Bill Act reduces federal funding for healthcare programs. As eligibility tightens and costs increase, millions of Americans lose insurance altogether.
The Congressional Budget Office has estimated that many thousands of people will lose their coverage, so there'll be many more uninsured who likely won't get the care they need, and when they do, it could bankrupt them.
These changes do not only affect patients. Hospitals and healthcare providers also face reduced funding, leading to staffing shortages, service cuts, and increased financial strain.
Hospitals serving low-income communities, they'll be laying off workers, they'll be cutting back, and very likely there'll be some hospital closures because that's a major source of support for those.
That brings up a question. Where does the funding go once it's taken out of healthcare? Over the next decade, the Congressional Budget Office estimated the law will cut more than $1 trillion from federal healthcare funding. At the same time, the bill also includes major tax cuts and spending increases in areas like defense and border enforcement, as well as tax breaks that disproportionately benefit higher income taxpayers.
So the question now is, when the government chooses where to spend, what is the value more? Weapons or the well-being of its people?
Because a country whose people are sick, uninsured, and afraid to seek help is not strong. Throughout this video, we focused on the right to life, a right the Declaration of Independence claims belongs to everyone. But in America, that right is being filtered through insurance, hospital bills, and government budgets.
If life is truly a right, then it should be available to everyone, not just those who are able to pay for it. Because a nation that claims to value life should never make survival a privilege.